Hi, Seamus.
Hi.
So we're going to move on to the physical part of your assessment today. How are you feeling?
Doing good.
Okay. So I checked in with the nurses station to get your vital signs. Your temperature was 98.4, your heart rate was 62, and your oxygen level was 100% on room air. Can you just tell me your height and your weight again?
I'm about 6'4", around 220 pounds.
Great. So the next thing I'm going to do is I'm just going to get a blood pressure. I'm just going to have you keep that arm nice and relaxed for me. (126/62). Very good. I'm going to get this off for now. And the next thing I'm going to take a look at is I'm going to take a look at his hair. What I'm looking for here is to make sure that his distribution's even. I'm going to check for any obvious lesions, any dry patches, any sort of infestation. And I'm not seeing any, which is great. He has no bald spots. Everything is even. Skin is intact. Scalp looks good. I'm going to take a look at his nails. So what I'm looking at for here is for any sort of cyanosis. I'm also looking for any clubbing, and his capillary refill is less than 3 seconds, which is great. I'm going to check the other side. Everything looks even and symmetrical. So I'm going to pause for a minute here. I'm going to just take in a general survey of his skin. I'm going to be doing this throughout my assessment, but while I have him sitting here, I can observe his trunk, most of his legs, just for any lesions, any lumps, any areas that are open. He doesn't have any of those. I'm also going to take a look at his skin tone. So his color is consistent with his ethnicity. He's not flushed, he's not pale, he's not jaundiced at all, so everything up here is good in that aspect as well. He's also warm to the touch, which is good. So I'm going to do just one last test. I'm going to look at his turgor. So I'm just going to make sure that his skin relaxes to back to normal fast after I pinch it. He doesn't appear to be dehydrated. His skin has good turgor, which is good as well. So I'm going to move on to his head. So his head is normocephalic. Can you smile for me? His face is symmetrical. I'm going to just palpate the temporal arteries. And I'm just going to be feeling his temporomandibular joint. I'm going to have you open and close your mouth. So there is a definite click there. It's actually even audible. I don't know if you heard that. Was there any pain involved with that?
No.
Okay, we'll keep an eye on that. So we're going to move on to his eyes. So the first thing that I'm going to do is I'm going to take a look at his external eyes. I'm taking a look at his eyelids. There's no swelling. There's no drooping. There's no outward crusting, anything like that. His sclera are white, and his conjunctiva are not reddened. So everything's good. His eyes aren't bloodshot. His eyelashes are intact. Everything looks good externally. The next thing I'm going to do is just a visual acuity test. So I'm going to have the patient cover one eye and read the bottom letters on that sign, please.
EJMC.
Great. And do the same with the other side.
EJMC.
Good. So the next thing I'm going to do is just take a look at his extraocular movement. I'm going to do a function test. I'm going to use the 6 cardinal gazes. I'm going to have him follow my fingers, so just move your eyes, not your head, please. Good. I'm going to have you follow my finger out and then in. Perfect. So the next part of my exam for his eyes, I'm going to check his pupil constriction. I'm going to make sure that while one constricts, the other one has a consensual response and constricts on the other side as well. So again, I'm going to have you look at my finger. I'm just going to be shining the light briefly in your eye. Very good. So we had the constriction. It was consensual. His pupils are equal, round, and reactive to the light, which is great. So that is really it for his eyes, and we're going to move on to his ears. Again, we're going to first stop and inspect the external ear for any sort of lesions, any sort of redness, anything that looks abnormal. I'm going to palpate for any tenderness. I'm going to palpate the tragus. Is that tender at all?
No.
Any tenderness at all in your ears?
Nope.
Good. So I'm now going to get my otoscope. Bear with me. Okay. So in the real world, I would have a cover to put on over this, but I do not have one of those available with me now. So I'm going to be careful to brace my otoscope. I'm going to pull back on his ears. So I'm going to be looking at the external ear canal and then the tympanic membrane. So I'm going to be checking the tympanic membrane for any bulging, any abnormalities, any signs of infection, and everything's looking good in there. So I'm going to move on to the other side. Alright. So the last part of the last thing I want to focus on with his ear exam is just his hearing. So throughout the exam, he has been responding in a normal tone of voice, which is a good indication that his hearing level is adequate. But I also wanted to do a whisper test just to be sure. So I'm going to have the patient cover one ear. I'm going to whisper 3 letters, and he's going to repeat them back.
FCB.
Great. I'm going to move around to the other side.
FCB.
Great. All right. So that is it with the ears. We are going to move on to his nose. So we're going to just take a look again, always at the external structure first. Make sure everything's symmetrical. I'm going to go down here. I'm going to check for any septal deviation. There is none. I'm going to use my flashlight and just to make sure that there's no sort of obstruction in the nasal passageway, which there isn't, which is good. So the next thing I'm going to do is check for patency. I'm just going to have you block one nostril, blow out. Very good. And the same thing with the other side. Good. So now I'm going to palpate the sinuses. I'm going to be looking for any sort of tenderness here in the patient. Any tenderness?
No.
Good. I'm going to percuss as well. Again, looking for some tenderness. Any tenderness, anything? No. Okay, great. So I'm going to move on to his mouth. So the first thing I'm going to look at is the external appearance of his lips. They're a little bit dry, but it is the winter, so that makes sense. But there's no any sort of crustaceans, lesions, sores, anything like that, which is good. So I'm going to have you open your mouth for me. So first, smile big. I'm going to be taking a look at his teeth and his gums. So his teeth have no obvious areas of decay. Gums, no bleeding, no swelling, which is good. So I'm going to be taking a look at his tongue and his mucosa in there. Everything looks intact. I'm going to have you stick out your tongue and say, ah. So right now I'm assessing the uvula. It's midline. There's no swelling. Everything looks good. I'm looking at his tonsils. I'm checking for any inflammation, any sort of white spots in there, any swelling, and none of that, which is good. Okay. So I'm going to move on to his neck. The first thing I'm going to assess is his range of motion. So I'm going to have him move his neck forward, backward, side to side, and in a circle for me. Any pain, stiffness, difficulty doing that at all?
Not at all.
Good. All right, so I'm going to move on to his lymph nodes. So I'm going to start with the preauricular, the posterior auricular, the occipital, the tonsillar, submandibular, submental, the superficial cervical, the posterior cervical, his deep cervical chain, and I'm going to end with the supraclavicular. So I'm checking right here for any lymph node enlargement and if the patient were to report any tenderness with the exam. Did you have any tenderness?
Not at all.
Good. All right. So the last thing I'm going to look at is his trachea. I'm going to make sure that his trachea is midline, that it's not obviously deviated, and it looks good right now. For the thyroid exam, I'm going to just get behind the patient. With my right hand, I'm going to displace the trachea. With my left hand, I'm going to palpate while the patient swallows. Can you swallow for me? Good. And I'm feeling here for any thyroid enlargement, which I felt none. So that's good. So moving on to his lungs and thorax section, I'm just first going to inspect anteriorly and posteriorly. And I'm looking just at the shape, making sure everything's symmetrical, looking at his scapula, the curvature of his ribs, everything like that, making sure it appears to be normal. I'm going to observe him take a few deep breaths. I'm just going to make sure that the chest rise and fall is symmetrical, which it is. Everything looks regular. All right, thank you. So now I'm going to just palpate, and I'm going to palpate for any masses, any sort of crepitus, and any tenderness as always. Any tenderness?
Nope.
I'm going to palpate posteriorly as well. Okay. So the next thing I'm going to move on to is percussion. I'm going to just do the back first and percuss over the lung fields. So I'm going to want to move side to side. And the primary tone over the lung fields is resonance, which is normal. So while I'm back here, before I percuss the front, I'm just going to check for some CVA tenderness. Did you have any tenderness there?
Nope.
So we're assessing for flank pain. He had none, which is good. So now we're going to percuss on the front. I'm going to try not to block what I'm doing on the camera. Good. So we're going to move on to listening. I'm going to listen just to the front lung field, or rather I'm going to listen in the front to his lung field and then move on to his back. Nice deep breath. Good. So now I'm going to be listening in the back, and again I'm going to move nice and symmetrical from one side to the other to assess the lung field. Deep breath. So what I'm hearing are nice, clear lungs with good expansion. They're not diminished. There's no crackles noted, no rhonchi, no rales, no wheezing, which is important. So everything's sounding really good. At this point in the exam, I'm just going to take a look at the patient's chest. I'm just going to observe that his nipples and areola are symmetrical, and I'm going to palpate for any tenderness up underneath the armpits, for any swollen lymph nodes or tenderness. Any tenderness?
Nope.
So at this portion in my exam, if I was examining a female, I would kind of go over the importance of self-breast examination. I would talk about how it would be important to do it at the same time of the month because different times of your cycle can cause changes in your breasts that are completely normal, and to kind of just eliminate any false concerns if you do it at a consistent time. I think 5 to 7 days after you start your menses. If you remember that time, do it at the same time every month, you can kind of get a better, more accurate idea of the normal breast exam for yourself. So it's important to take a look at your breasts with your arms by your side, over your head, and kind of resting behind your neck. And what you're looking for is symmetry, making sure that there's no dimpling, and just making sure that everything appears the same on both sides, really. My preferred method of self-breast examination is to kind of start in the center and move outwardly in a circle and just palpate in a circle all the way around underneath the armpit on both sides. It's also important to always be following up with your primary care provider about any sort of testing, any routine screening that you should be having done. So that's pretty much the education that I would do if I had a high-risk patient. And so for right now, I'm just assessing symmetry and everything on him. Okay. So I'm going to move on to the heart and neck vessels. What I'm going to do, we have some tangential lighting in this room just to make sure that we can see if there's any sort of bulging vessels, anything like that. So I'm going to be looking here for any sort of jugular vein distension. There isn't any. I'm going to palpate the carotids. Good. And I'm just checking for any sort of pulsations. I'm going to check over the precordium. Just make sure that everything looks good. I'm going to use my bell and see if I can hear any thrills over the carotids. Good. And I'm going to palpate the PMI on him. Good, I'm getting a good pulse over here. And I'm going to come back and listen to that later in my exam as well. So the next thing that I'm going to do is I'm going to be listening to his heart sounds. I'm going to switch my stethoscope back over. Good. So I'm listening for S1 and S2, making sure that the rate is regular, or the rhythm is regular, and that the rate is normal, rather. Good. So I'm going to switch my stethoscope over. I'm going to use my bell, and I'm going to make sure that I don't hear any sort of murmurs, anything like that. Good. So his rate, we had his vital signs. His heart rate was in the 60s, which is good, and my assessment matches that finding, and his rhythm is nice and regular, which is good. So I'm going to just make sure that his extremities have no pitting edema, nothing like that. No edema here on his ankles, or no pedal edema, which is good. Alright. So, we're going to move on to the next section of the exam, and I'm going to have you lay flat for me because we're going to be taking a look at your abdomen. Thank you so much. Let me move this so you're a little more comfortable. Alright, so the first thing that we're going to do is just visually inspect the abdomen. We're going to look at the contour, make sure everything looks symmetrical, make sure that there's no obvious bulging, anything like that. And the first thing that I want to do before I touch his abdomen is take a listen to his bowel sounds, because palpating can kind of falsely produce some bowel sounds, so we want to make sure that everything we're hearing is genuine. So his bowel sounds are normal active. They're present in all 4 quadrants. They're not hypoactive or hyperactive. So I'm going to move on to percussion. So there's a nice tympanic tone over the abdomen. I'm going to percuss over the liver on the right upper quadrant, kind of tucked under the ribs. Okay. And I'm going to move on to my palpation. I'm going to use light, medium, and deep palpation. I'm going to be assessing for any organ enlargement, any tenderness on the behalf of the patient, things like that. A little bit deeper. Any tenderness or discomfort?
Nope.
Good. I'm going to palpate for the liver on the right upper side. Alright, good. So while I'm here, I'm going to check his inguinal lymph nodes as well as his femoral pulses. So I'm checking for any node enlargement. And for his pulse. Okay, good. While you're laying here, I'm going to have you raise your head. And I'm going to have you cough for me. So I'm checking here for any bulging, any signs of hernias, which he has none, which is good. The last thing I'm going to check is just to confirm that there's no rebound tenderness on this patient. Any pain at all?
Nope.
Alright. So that is it with the abdomen, and we're going to move on. We'll have you sit up here we're just going to take a look at his musculoskeletal system. So the first thing that we're going to really look at is his range of motions. We want to really assess the range of motions of all his joints. So I'm going to have you move your shoulders for me, elbows, wrists, fingers, good, knees, good. And I'm just going to help them kind of hold up his leg so you can see ankle movement on both sides. Great. So any pain with that?
Nope.
Good. I'm also going to be palpating his joints. What I'm looking for is for any sort of tenderness, warmth, redness, inflammation here, which I'm not feeling any. Good. Always want to check that everything's the same on both sides. And I'm palpating the ankle joint down here on both sides. Okay. So I'm also just going to take a look at the muscle tone and strength, checking that he has good muscle tone. And so I'm going to have him, for this portion of the exam, can you pull back against me? Good. Can you push against me? Good. So he has good strength, it's symmetrical, there's no discrepancy from side to side, which is good. So we're going to do the legs as well. So I'm going to have him push up against me, and push down. Good. Great. Good strength. So we are going to just move on to the last kind of segment, the neuro segment. But we're going to pause before we do that. I'm just going to do the reflexes while he's sitting here. So we're going to do the bicep reflex, tricep reflex, brachioradialis. I'm just going to, the key here is to make sure the patient's nice and relaxed. Good. So again, bicep, tricep, good. So I'm going to have you scooch back a little. He's tall, so I just need to get his legs kind of raised here. We're going to check the patellar reflexes. Good. All right, and I'm going to help him hold up. We're going to check the Achilles reflex. Just nice and relaxed, please. Okay. Nope. Nice and relaxed. Is that uncomfortable?
No, it's good.
Okay. All right. So I'm going to just confirm his sensation is intact. So I'm going to have him close his eyes. I'm going to ask him to tell me where on his body I am touching him.
Left foot. Left hand. Right foot. Right hand.
Good. So he's able to tell that, so I'm going to have him keep his eyes closed. I'm going to ask him to discern between sharp and dull.
Dull. Dull.
Sorry, that was my fault.
Sharp. Dull. Sharp. Dull.
Good. All right. So at this point, I'm going to make sure that I go through, while he's sitting here, all of his pulses as well. So I'm going to check radial. Okay, I checked his femoral pulses during the abdominal assessment. I'm going to go now behind the knees for the popliteal. Just checking to make sure that they're equal on both sides, equally strong. He's at about 2+, which is normal. We're going to check the post-tibial, near the ankle here, and then the dorsalis pedis, which is right at the top of the foot. Good. All right, great. So I am going to have you stand up. I'm going to have you bend. We're just going to assess range of motion on his trunk. Kind of move side to side for me. Good. I'm going to have you stand up straight. So he's a little bit tall, so his head's not on camera, but I'm going to have him close his eyes. And I'm going to test his cerebellar function here. I'm going to make sure he's not swaying, having any sort of problems maintaining his balance. Good. And now I'm going to have him raise his arms. Just take one step to your left, please. Good. And now I'm going to check for pronator drift. His eyes are still closed. He doesn't have any drift, which is excellent. So I'm going to observe his gait. So I'm going to have him just walk normally. Okay. Good regular gait here. And lastly, I'm going to have him walk heel to toe. All right. Great. So I'll have you sit down. So that's just about completes the physical assessment portion. Do you have any questions for me?
No, I don't think so.
Okay. Thank you so much.